Ashutosh ji, let
Yes,
us.
yes, ma'am. Recording has started, so
Okay,
you can commence your
okay,
session.
okay. Thank you. And I think everyone knows me, so I'm going to go to next slide. So these are the agenda today. First, a little bit of basic information about antigen and antibody and virus mutation versus virus versus bacteria, different types of vaccine and how vaccine work, what is herd immunity. And there are two websites which if you want to look into detail is historyofvaccine.org and ask the expert. So you can ask any question about vaccine is immunize.org. This is basically for like a layman term and some medical term also. So the next is, so what is immune system? Human body have a very robust immune system or defense mechanism. And I'm not going to go into all detail, but the one of the is antibody formation against any antigen. So antigen is any foreign body enters in your body, in human body is an antigen, which can be either protein or other different forms, but will go mostly by protein. So virus or bacteria, when enters in human body reacts to it and produces antibody. And it is specific to that virus or bacteria. In other words, measles enters in body, it has antibody which will kill only measles, not something else. So that is a very specific antibody formation against that antigen. Now this is a little bit of picture if you can see. Sorry. I'm going to enlarge a little bit.
Yes, we can.
Okay, now can you see now? So you
Yes, we
can
can
see
see.
different pathogen, measles, flu, chickenpox. And if you have already all these, then you have antibody, which is on the right side. And antigen, you can see tiny spikes. And in terms of COVID, there was spike protein. And antibody is formed against those spike proteins. So antibody, spike protein is antigen, and the human body is producing antibody. Now, when you have pathogen which human have never exposed to, you don't have antibody. And also, let's see if you have measles as child or you have vaccine as child, you have memory cells to produce those antibody. Now, COVID virus was, humans were not infected, so there was no memory cell to produce those antibody and there were no antibody. So that the havoc created because of that, one region. So this is the picture which is very important to understand how vaccines are formed. So you can take a piece of virus, inject human body, it will react similar way as natural infection. So vaccines are not something out of a different place. It is actually either whole virus weakened or it is a part of virus or code of that particular antigen. In COVID, it was a spike protein. So that's the code which produces that antigen. So every human, every living cells have different genetic material which creates that particular antigen or any specific protein. And that genetic material can be introduced to human body and that will produce the antibody. So this is the specific picture. The Y shape is the antibody, and this on the left side is your antigen, a part of the virus. So this concept is very important because rest of the talk, I'm just going to call antigen antibody, and you have to just understand that vaccine is part of the virus. It is not something separate. So anything which virus does, potential to have vaccine can also do that. The only thing, it is the small amount is so tiny and it is not a live or strong virus like a natural. The illness or disease is much less than actual virus. So other question is, what is herd immunity? So the herd immunity is, herd means basically people. So the community, if let's see, there was a question asked, what is the, if you have 1 lakh people, uh, how, if you have 1 lakh people, and let's see that particular virus requires to move around the community, if certain number of people are immune, it is not going to, virus is not going to move around, because everybody or particular number of people are immune to that virus. In other words, they have antibody or some other form of immunity, and then viral will or where bacteria can get killed. So herd immunity is number of people need to be immune to that virus or bacteria, so that virus or bacteria does not circulate in community. Now that's the what role of vaccine is. You don't want an entire community to or entire herd to be infected and be killed. So the purpose of vaccine is to create that immunity without causing any illness. That is the purpose of vaccine, to create that herd immunity, uh, so that virus or bacteria does not move around in the community. Now there are few things we need to know about virus or bacteria or and the herd immunity. Give me 1 second. So again, the herd immunity varies by host factor and pathogen. In other words, host factor is if people were not ever exposed to that virus or bacteria like COVID, versus measles or chickenpox where people are already exposed. So that is the what we call herd immunity threshold. That, and that depends upon host and also pathogen. How contagious is the pathogen? If pathogen is so contagious like COVID that you sneeze and you get someone else is getting infected, that's a very contagious. You need a very high grade of herd immunity to overcome that circulation of virus or bacteria. For example, in case of measles, every 94 people has to be immune out of 100 to be immune to has to be immune to spread the of the virus. So you can see herd immunity in case of measles is very high. Now the other important part is, let's say people are not getting naturally infected, but they are getting vaccinated. If new people are not getting vaccinated, this herd immunity can be lost. And this was seen during, there was multiple outbreak of measles, because during COVID, many children did not get vaccinated. So there are pockets of outbreaks of measles because of the loss of herd immunity. So keep getting vaccine depending upon how long you need, for smallpox only once, for tetanus every 10 years. So depending upon that duration of protection, you have to keep getting immunized to keep that herd immunity intact. About COVID-19 and RSV, there are two viruses which are circulating, is still circulating. Herd immunity is not alone, is not a very realistic goal because of their contagiousness and the how frequently they are changing, they are mutating. So important part is control and limit the spread of the virus. It's also, so herd immunity alone is not. So if you see people are sneezing and things like they have COVID or RSV, you need to either especially immunocompromised patient, they need to wear mask, make sure you clean your hand, and all the like a door handle and everything. So those infection control part need to continue to be like that need to happen. Herd immunity is, in case of COVID-19 alone, is not enough, in other words. And there are multiple reasons behind it, so but it's beyond my scope here. So then what type of vaccine we have? It's another very important part is that all vaccine what we have, including COVID vaccine, those are not new vaccines. Those are all we have. So for example, live attenuated. The live attenuated means you take a virus or bacteria and weaken that bacteria or virus in lab. So it becomes attenuated or weakened virus, but it is actually still live. And oral polio, which is given in India, it is a live attenuated virus. So be clear about it, that this is a live virus. And also how this concept came. So there was a case in measles in 1954. A boy has measles, and that virus was taken in the lab and cultured for 10 years before this virus got attenuated. And that's how the vaccine of live attenuated virus, one of the waves started. Now, the same live vaccine, live attenuated, can be inactive, but is still the whole virus. And that is the injectable polio, which is given in US. And so the concept of that live attenuated or oral polio is safer than inactive one or injectable one is not correct, because injectable polio virus is killed virus and oral polio is actually still alive, live virus. And there are and the incidence of actual polio by the vaccine is around 1 in 2+ million. So in other words, someone can get polio by oral polio vaccine also. Very rare, but it can happen. The other type of vaccine is the number three is subunit, means there is only tiny piece of the bacteria or virus taken. Conjugate, where you have multiple, like a few. Toxoid like tetanus. We take tetanus vaccine. It is toxin producing, and the toxin is the antigen. So you take the piece of toxin and inject to human, and that will produce antibody. So tetanus, diphtheria, and whooping cough, all three are toxin vaccine. The recombinant, it's a little bit beyond, but it's basically generated. Hepatitis B has those. Now the question was asked, what is mRNA vaccine? So mRNA or messenger RNA is a genetic material which codes that antigen. So rather than giving someone antigen, why not we just give the code to humans? And that's why Moderna or Pfizer vaccines are. Those are tiny mRNA particles which are given to humans, and that goes into the cell where it creates that protein. Protein comes on the surface of the cell that is recognized as antigen by human body, and the antibody is produced. So those are the mRNA vaccine. The concept is not new. It is very, very many decades old, and they always wanted to use this. The reason why, because it is very easy to create on mass scale, and also it is not live virus, so side effects should be very low. It never goes in nucleus, so it will not change the genetic code of the humans, because there was one question that whether this genetic material is going to change something in the human body, and that is not correct. The another live attenuated virus is BCG, which is also given in India. So BCG is also called bovine TB bacteria. So in old age, when we used to get, people used to drink milk without pasteurizing, people have this TB, which is bovine TB from animal, from the cow. And they saw that it was also protecting to some extent a human TB. So that's how it was started. So the BCG is a live attenuated bovine TB bacteria, and that is given at childhood. The other type is what we call viral vector vaccine. So here you take one tiny piece of, like example, COVID virus, give that to another virus, which is mostly adenovirus, and a very benign virus, doesn't give you much disease, and that is given to humans. So this adenovirus takes the COVID virus, part of the COVID virus, and goes into human, produces the spike protein or whatever antigen, and then human body recognizes that this is something foreign, and then produces antibody. This is what AstraZeneca is. It is a vector vaccine. Other vector vaccines are Ebola, Zika, flu, also many of them. So these are not something very new concept. This is all old concept and has been given for many decades. The other is, I put this here, it is this is epidemiology and prevention of vaccine preventable disease. This is from CDC site. This is called Pink Book. Everything about preventable disease, including vaccine, is in this book. So if you really want to know, go deeper, you can use this book. If you just press CDC Pink Book, this whole book will be, you can see the whole book.
Ma'am, your slides are getting uploaded. So can you use this icon next to the
Hold on a
slideshow?
second. Yeah, hold on a second.
There is an icon next to slideshow. So maybe that will work for you.
Which one? This one? Yeah, so I'm doing this, but it doesn't change the slide.
No, no, go to the next icon. Just next to it, there is one more icon. Try that.
This one,
No, yes, that one.
the reading view. You want the
Yeah,
reading view?
reading view. Yeah,
Okay.
that will be better if slideshow is
Okay,
not
yeah.
working.
So
This is better.
okay, good. So this is another type of vaccine, yeah, vector vaccine I already talked about. So Johnson and Johnson and the Covishield or AstraZeneca both were vector vaccine. In other words, tiny piece of COVID virus taken, given to adenovirus, another virus, and given to human, and protein is generated there, and that is your antibody body was formed after that. Other question was what is Covaxin? That is which is in India, produced by Bharat or some name I don't remember. But Covaxin is inactivated or killed, but it is whole virus. Now, one thing I forgot to tell you, whole virus, whether inactivated or attenuated, they produce a very robust immune response. So some people say, okay, it is more protective. That is the case because its whole virus is given. And then French and American Velnova was also inactivated whole virus. There is one vaccine which I didn't read much about, and it's not much in literature, is DNA vaccine. Now, the DNA vaccine here, rather than RNA, it is the whole DNA of the virus is used. And there was one vaccine which was the first to given to human was DNA vaccine, and that was in India. Now, DNA vaccine is very prevalent in for animals, so it's not something new, but never given to humans. Now, side effects. This is the important part. There are two websites. One is HSS VAERS, which is the uh, Vaccine Adverse Reaction Reporting System, and the another one is also at the bottom, if you can see. That is two website where you can look around, like everything about side effect is reported there. And then couple of side effects I already mentioned about oral polio vaccine. You have 1 in 2.7 million. Some places they say 2.4 million doses given. One person will get paralytic polio. Then you have multiple sclerosis, heart attack, autoimmune disorders, anaphylaxis, some brain problem, and the TTP, TTS, then other is thrombocytopenic. All these vaccine side effects. This is not just the COVID vaccine. This is many vaccine can do the similar thing. In other words, COVID vaccine is not the one which just gave you the side effect. These are reported, and you can go through those websites and you can see which vaccine gives you which side effect. More in the news was the TTS AstraZeneca one, but actually that is also seen in Johnson and Johnson. For some reason, just AstraZeneca was more published, but not in Johnson and Johnson. Both are not given in US, so I cannot tell you much about. But one part is it is removed from market. Every vaccine which were older are removed from market, and the reason why, because the vaccine, the COVID and flu both are, or every virus actually mutates so frequently that old viral vaccine are not going to work. So they always go by the circulating variant and produce vaccine accordingly. So it's as AstraZeneca removed the vaccine from the market. It was a breaking news, but it's not that a breaking news because everyone, all of the vaccine, Moderna, Pfizer, Johnson and Johnson, and other vaccines have been removed from market also. Around the globe, there are 40 COVID vaccines, 40, number 40. vaccines we have. Uh, US have already new vaccine for currently KP2 or whatever they call it, circulating variant. So 23, 24 vaccine is different. So whatever Pfizer and Moderna was using last year or year before, it's already thrown away. So that has been removed from market also. There is something called escape mutation. This question was asked, what happens when you give vaccine, what happened to your immune system, and what happened to a virus itself. The virus are, they mutate all the time. All virus mutates. That's the part of the problem with the virus, and that's why it's very hard to create the vaccine which is stable forever. They always need to keep changing. And also antivirals like antibiotics, it's very difficult to create because they always change. So sometimes what happens when vaccine is given, they mutate too. And other time is sometimes human body does not produce antibody to those virus. Those are like a little bit beyond to go through the detail about how this happens, beyond discussion here. But yes, sometimes vaccine can produce something which is unwanted. Now, this site is I added this because someone asked, what is US doing for? So US has whole reporting system. Number one is VAERS, which is again vaccine adverse reporting system, where any patient, any doctor, anyone can report, even if they that not clearly that their side effect is from vaccine, still you can report. The next is VCD or vaccine safety data link. If you want to look into rare and serious side effects, it is reported here, and more than 180 million vaccine record is there. So yes, uh, uh, multiple sites you can see if you want to go through all these sites. They report. PRISM is on not only just vaccine, this is for post licensure. This is not just for vaccine, but actually medication. So if you're taking medication, you want to see what is the post licensure side effects or post marketing side effects, you can actually look into those. The WISP is also, so other question was, what is the legal issue or what compensation is given to? So in 19, I think 50s or 60s, when polio vaccine come, by the way, it was invented in Pittsburgh. So they used oral polio, which was a live and attenuated vaccine. So many people actually, children develop polio because along with the live attenuated, there was some wild or natural strain left in that. And after that, many other vaccines were produced and people were suing left and right. And many companies, either they got bankrupt or stopped producing vaccine. So the government thought that this is not good for public health. So they started this compensation program. So yes, US has compensation program also. And there are multiple legal requirements before you give to vaccine to children. So US have pretty robust side effect monitoring and compensation program. Many of the developed country also have. Developing country lack this kind of program. But WHO, if you want to see World Health Organization site, they do monitor how well they do. I did not explore that much, but there are sites where you can see how vaccine is from every country, and all vaccines from around the world is actually documented there along with their side effects. Now, this is a very important slide. This was done in Infectious Disease Society uh, in US, and they look into three group of patient. One group which have vaccine and COVID, another group who has COVID but no vaccine, and the third group who had no COVID but just the vaccine. And what they found that immune response or immune system of human were best in when who got vaccine alone. In other words, vaccine does not decrease your immunity. Actually, COVID itself decreases your immunity. And have least was in patient who have COVID but no vaccine. So if you have COVID and you have not taken vaccine, likelihood of that your immune system has suffered is much higher than the vaccine itself. The other important part was, and this is related to side effects of uh, vaccine. I just added here, this was published in JAMA, which is an internal medicine journal. I think everyone know what placebo effect is. So in other words, if company is doing some research and the two group of patient, they give medication. One is actual medication, another is kind of sugar pill. So that's, but effect is seen both in sugar pill patient and actual medication pill. That's the placebo effect. Opposite is true also, that when you do side effects check, people who got actual medication, they have side effects also, and people who got placebo or sugar pill, they also have side effects, and that is called nocebo effect. So this is also, there was concern that so many people have side effects from vaccine, whether the part of the problem was the nocebo effect. That's why I just added here. Now, what is our next pandemic? So number one, COVID is still in, it is worldwide, is still in pandemic. And recent data from year 23-24, when they compared, this is US data, when they compared flu versus influenza versus COVID-19, they found that mortality and morbidity from COVID is still slightly higher than flu. So it's not gone yet. In terms of a variant, in US, the KP23 is still high. It looks like 30%. It is more transmissible, but it's not give you more severe disease. It is still a variant from Omicron. So it's not that something completely new. Now, by the way, mutation of flu is much worse, is worse than mutation of COVID. COVID is a little bit slower than flu. Also, they checked what we call seropositivity, means how many people have antibody. Many people still have antibody, people who got either disease or vaccine. And so this is what called hybrid immunity, where patients both have COVID and vaccine. So their high population still have antibody. So we have not lost all the antibody after COVID. The next pandemic recently came as CDC have warned, is next pandemic will be H5N1, which is influenza type A and the commonly called bird flu. And that is a very important to know that we need to keep eye on it. So clean hand and mask use when many people have cough and like any kind of symptom, uh, you be careful. So next pandemic can be bird flu. There is another term we called, and this is also very important because there are so many pets we have now at home, is reverse zoonosis. So zoonosis means anyone who get a disease from animals, like COVID is called a zoonosis because it came from animal to human. Now humans can also give disease to their pet or other animals. And that is why it is so important, because this is a very dangerous situation. Animals already, they have multiple virus in them, and now this is human virus which is going to animal, and variant they will produce, who knows what is going to happen. So yes, your pet is very nice to have multiple pets, but be careful what you do to them. So the other question was asked, where did this SARS-CoV-2 or the COVID virus came from? Some ask, was Canada, and then how it went to China. Result is not out yet still. There is extensive research going on. So we will not know for many years now. So I'm not going to talk about that more. But it's not that anyone has scientific community have forgotten. They are still doing the research on this, where the virus came from, because it is important to know where the virus comes from, because it can be used as a bioterrorism. And that's why people are not going to forget this. So this is again the update or withdrawal or vaccine chain. It's the AstraZeneca I already talked about. Same thing with bivalent mRNA vaccines are also not being used. Flu vaccine is yearly updated. So it's every year, this is the old vaccine are thrown or withdrawn and updated depending upon which variant is circulating in community. In case of smallpox, again, each disease or each virus needs their own time, how long their antibody is protective against them. So smallpox was given once. There is some question raised, and actually military personnel are given smallpox because not exactly smallpox, but there was a question whether the current population is not necessarily vaccinated. What if some of these smallpox gets in the community, which are saved in lab, so that can be used as a bioterrorism. So especially if it's in military population. So it's just a little bit of threat. That's all. In case of Tdap, which is tetanus, diphtheria, and pertussis, I think in India, children get, but adults do not get, which is the wrong thing because you can have pertussis even when you are older. So it is only it should be taken every 10 years. A specific an important point is if a very bad wound you have, you should take tetanus if it is 5 years have passed before you have taken tetanus vaccine, you should take tetanus vaccine because it doesn't last that long if it is bad wound. Like accident, you should have. But I think this is a common way to, we used to see people come and they get tetanus vaccine because nobody goes for repeat ones. So ideally, every 10 years, you should take the Tdap. Hepatitis vaccine is also given once. And COVID vaccine, again, the virus mutates, it will be, I have not taken, I'm taking my chance, the new one, but there is a question whether I should go and take the new variant or not, because it is just a tiny piece of virus. What can happen even if it is new formula? It's still mRNA. I don't know what India is doing right now, but total COVID vaccine is given is 13 billion doses around the world. So it's a large number of vaccine given. So we will have a very high degree of like a side effects reporting by these many numbers of vaccine given. So hopefully in next few years, we will know exactly. Now, most of the side effects are short term. So far, there is no vaccine which has reported side effects after many years. So most of the COVID vaccine side effects was within few weeks. So we don't expect to have long-term side effects from the COVID vaccine either. There was some case that measles vaccine is giving autism, which is already disproven. So no, there is no long-term years side effects after years. There is another thing which these are the right side. You have a multiple website if you want to know about types of vaccines. So if what 5, 6 different types of side effects of vaccine is also reported. Vaccine compensation and injury, that is the third one. ID Society actually tells you about the long-term immune damage if you want to look into that. JAMA network, I already told you, nocebo versus placebo effect. CDC.gov has many vaccine given uh, about vaccines, the reporting and how to take vaccine. I mean, very detailed about vaccine. You can go. Someone asked, I think Anurag asked, travelers, what should travelers do? Because CDC recommend multiple vaccines if you're going to certain area, like Africa yellow fever vaccine. Now, again, it is your choice. What are you going to do there? How you are going to expose to that particular disease? That's what you have to know. If you go to someone's house in Africa and never go outside, you don't need a vaccine. But if you are moving around in community where the high incidence of yellow fever, then maybe it will help you. So it's same thing with any vaccine. It depends upon you, host, how immunosuppressed you are, and the incidence or prevalence of that particular disease in that community. So it is very, very like a personal thing. So I cannot give you complete answer that who should get or who should not get. The pink book, I already talked about the epidemiology about vaccine and preventable disease. This is available on CDC site. MayoClinic.org have a pretty nice layman term article on different type of vaccine and how they work. If you want to see, WHO have site on Global Advisory Committee on Vaccine Safety. They have a separate website for that. You can look into that. If you have time, you can go through these. I didn't go too much on the detail. This was just a tiny overview about vaccine. A little bit, maybe you will know a little bit more, I hope. The right side is the conversation.com, a site I sometimes visit, and they put a very nice something which stuck to me is that the pace of COVID vaccine development shows that possible when political will and pharmaceutical interest funding is there. How fast COVID vaccine was produced, it was unimaginable that so fast it was done. On the other hand, tuberculosis is prevalent in developing world for hundreds of years. BCG vaccine is the only vaccine which can give you a little, can be, you can save some children by BCG vaccine, but no vaccine has been created. Now there are some new research going on TB vaccine, but TB is the forgotten pandemic. Someone has asked question about what rich country are doing, what poor countries are doing, and how that gap can be filled. And again, those questions I don't have answer, but this pretty much tells you that political will and pharmaceutical interest funding is there. And I think India does have enough funding. Even Bill Gates provides enough funding for vacation. So it's political will that can create a TB vaccine. Okay, so we are ready now for question. Ashutosh ji?
Yes, ma'am. Thank you. And I know that many questions have been asked, have been answered by Sarita ma'am, but we are open for the questions, and I can see the first hand being raised here by Dipankar ji. Dada, over to you. You can ask a question.
Yeah. I'm audible, right?
Yes, you are.
Yeah. Take a case that, let's say I am affected by COVID and I'm cured.
And cured, okay.
Right. So where am I? Does it mean that I have learned to create antibody?
So yes, all natural, because vaccine, COVID vaccine or any vaccine is actually part of the bacteria or the virus. So the human body doesn't require a, a live virus or bacteria. They just have to know what is the antigen. So antigen can be a part of virus or bacteria. Like for COVID, the spike protein was the antigen. So if you give a spike protein, whether in vaccine or natural form, your body will produce antibody. In terms of cure
I
part,
am not vaccinated.
so yeah, you are not vaccinated, and I showed you a PowerPoint. The antibody which lasts in terms of COVID, we don't know how this is going to pan out, but vaccine was not protective for 1 year. People who got the vaccine, they were also infected a couple of times. What vaccine does, it prevents you from severe disease. In terms of COVID infection, you still have antibody, but your immune system is not that strong as I showed you the slide. So vaccine plus immune,
No,
plus.
I have seen, you wanted to show me, I have seen that, I noticed that. But why? I mean, my question is why? If
Okay,
my body has learned how to create antibody, then I'm in effect vaccinated, right?
Okay, so yes, so
And
vaccinated, yes. But if you remember, I also showed you that you only need one time smallpox, whether it's vaccine or disease, and you are cured and good enough for rest of your life. But in
right.
case of tetanus, even if you have tetanus or you got the vaccine, the effect will be the same, but it only lasts for 10 years. In other words, human body memorize that antibody formation for that particular disease. Unfortunately, that memory wanes over time. So in COVID, the memory is even short term. Now, we don't know much about COVID, but recent people who are like doctors and nurses, we just gave our blood to see how much antibody we have. We still have antibody, so likely that you still have the antibody. Whether you need to take vaccine or not, that is the same question. Question in the sense that based on research, the immune system was perfect if you have vaccine and a disease. And the highest was with the vaccine, without the COVID. And the reason
Yeah,
why,
yeah.
because COVID decreases your immune system. It produces antibody, but in general, it can decrease your immune system. Now, why do you have to take, you do not need to take vaccine? Then one thing I always tell people that medical science, for example, let's see 100 people are infected, a given vaccine, and 50 have side effect, but 25 only reported and 25 did not report. The
Right.
25 who did not report did not happen. So your question can be answered only by evidence. Okay, so the evidence is people who have COVID, but they did not took vaccine, their immune system is not that great as with the vaccine. In other words, you can get infected again multiple times because of the new variant. In other words,
Agree.
if you have one, you got infected from previous variant, you can be infected again with a new variant unless you
Is it
get
is
vaccine.
the vaccine that way
Updated.
broadbanded?
Yes, so the vaccines are updated, especially in US, definitely. I don't know about India, what's going on, but in US, the vaccine are updated based on circulating variant.
No, okay. My question is very simple. Let's say uh, last year, 1st August, there are two people. One got COVID and
Mm-hmm,
got cured. The
mm-hmm,
other person did not get COVID and he took COVID vaccine.
mm-hmm,
Now, in both the cases, they are effectively vaccinated,
mm-hmm.
and for both of them, there will be mutation of this COVID.
Okay,
So why are not they on equal footing? My question is totally technical.
okay. So the technical is, if let's see everyone vaccinated, that's what the herd immunity comes. You are not taking vaccine for yourself alone. You are vaccinating yourself also for
Agreed.
others.
Agreed.
Okay, that is the purpose of vaccine. Let's see, every entire community can have disease. Everyone has disease, and they are all vaccinated naturally, right? But then many of them are going to get killed by the virus because the purpose of vaccine is very simple. It's very simple. You give the same natural immunity, but you don't get the disease. That's the purpose of vaccine.
Okay.
You
All
are
right.
you Yes, you got one infection from one variant. Next time
So,
you don't need to wait for disease to get natural vaccine. You can take vaccine and get the same antibody, because the virus is notoriously, all viruses notoriously mutate. So you are not protected by 2 years infected when 2 years ago.
so okay,
You're not
I
protected.
think I'll just try to paraphrase it and tell me if I'm right.
Mm-hmm.
There are two persons. One got vaccinated and he's immune. The
Mm-hmm.
other one got affected by COVID and got cured, so he's also immune. But
Mm-hmm.
in case of second person, because he got COVID, he also has a damage in his immunity system.
Mhm.
That's why he is weaker.
Weaker, their immunity is weaker, yes. And also, I am assuming that you are saying both have infection and vaccine for the same variant. 2 year or 5 years from now, we don't know. This is
Okay.
will be
That is
completely
understood.
different. Yeah, it
That
will be
is
completely.
understood. Yeah.
So both are not protected, in other words. So
Yeah.
even if you have the COVID vaccine, the new variant may not protect, it may not be same level of protection. Old vaccines are not going to give you same level of protection for new variant.
Yeah.
So that
Thank
is
you.
the problem with COVID or many virus.
Thank you.
Okay, so before we move to the next question, ma'am, can I request you to stop sharing your screen? Then we can see the
Oh,
entire Zoom.
okay.
Yes, this is better. Okay, so next, I'll go in that order. There are many people who have raised their hand. So next is Sarda
Mhm.
Prasad ji. Sir, you can unmute yourself and ask your question.
Madam, am I audible? Yeah.
Yes,
Two,
very
three
well.
questions. Three questions. Some people had autoimmune diseases,
Mhm.
long-term rheumatoid arthritis, or many, many things. Huh?
Mhm.
So the vaccine, autoimmune diseases. So these people who have autoimmune diseases are suffering from autoimmune disease for long. Are
Mhm.
they protected from the vaccine equally as one who is not?
So do you want me to answer this one first and
Yeah,
then go
yeah,
second? Yeah.
this one
So
first.
okay, so the autoimmune disease means basically, especially when you are on immunosuppressive medication for that, you don't
Yeah.
produce the equal amount of or equally good antibody as a normal healthy person. So the whole purpose of when you have autoimmune disease, that means your own body producing antibody against against your body. That's what autoimmune disorders means. Means your body is in case of rheumatoid arthritis, your body is producing antibody against your joint. And that's
Mhm.
how you are getting joint damage. So to suppress that, what the treatment is, you suppress antibody formation. Okay. In other words, you are intentionally being immunosuppressed so you don't produce that kind of antibody, so you don't get the joint damage. Now think about that. The purpose of giving vaccine to produce antibody, but when you are on immunosuppressives, you are suppressed, so you are not going to produce similar amount of antibody. And we have a patient who was transplant and he got so many times 3 4 doses of COVID and he never produced any antibody. He died from COVID because of that. So yes,
So,
that is a
so, so,
problem.
so in that case, if someone is suffering from uh, autoimmune diseases for 35 years, after maybe 6 joint replacements, this and that, for
Mhm.
such a person, COVID injection, vaccination is helpful or avoidable or does not matter?
So in that case, what we do, we give COVID vaccine and check the antibody titer. Same
Okay.
as you do the for rheumatoid arthritis, you check antibody titer for
Mhm.
to
Mhm.
against your joint. Same antibody
Yeah,
titer you can
yeah,
do
yeah.
for vaccine too.
Uh,
And it is
Understood,
a
madam.
very common, very common thing. It's not just COVID. Many vaccine are given in patient with it, like a transplant patient, and
Uh,
we check titers. Yeah, we check
ma'am,
titers of producing
yeah,
enough.
yeah, yeah. Thank you. Second question. Uh, as you said, US, the protocol is to replace the vaccines content yearly. In India, very honestly, we do not know,
Yeah, we don't
and the rate of mutation of uh, yeah,
virus.
the virus is sorry, and that is not known. But sometimes Omicron is still reigning, but sometimes it can be 6 months, sometimes 5 months. So if I think that okay, yearly vaccination is a good program, I mean, let me switch over to yearly vaccination for safety, if nothing else. But how do you know? How do I know that the vaccine that is available in the market and the variety of the
Variant.
latest variant, do they
Mhm.
match or not match? Do they match or
Yeah.
not match? How do I
So,
know?
yeah. So that is the whole question. Government will, the political will, and who is actually monitoring all those. So in India, I don't think there is any kind of particular program. I mean, I at least I don't know. Maybe Dr. Jha knows about it, but I don't know that there is a program that they are checking which variant is you are seeing that. Now WHO actually they sent to WHO that this variant is in this country. How accurate it is, I don't know, tell you the truth. So in India, yes, you are right. We don't know which variant is circulating, and we don't know whether the current variant is equally effective, especially in your case, by the new vaccine, when the same vaccine or not. So yes, it is a problem. It is a big problem. And so that's why just prevent. If you
It-
go in a public places and you're immunosuppressed, make sure wear mask and keep your washing your hand.
mm. Now,
Don't
is
let
there
anyone
any
come inside house who's having infection.
that's
Protection is
that
this is the
yeah,
way to go.
that's quite simple. We can do it. The question is there not any global protocol that any country, any new virus breaks out, that they are
Mhm.
supposed to report somewhere, including the
Yes,
genetics,
WHO.
and
Yeah,
then
WHO. Yeah, they
and
do.
then that gets circulated to all countries, and from
Yeah,
there it percolates down to people. Is there not a method and the protocol, and that
yeah.
we are not privy to that info
No, you are.
as a
So
common
you
man?
can go to WHO site, WHO site, WHINTE International, and they have every country they are reported what vaccine was there, what side effect, which virus, where is the virus going, like which variant is circulating in which country. They have all the information.
And I
Who
heard about
is updating?
medications,
Medication
ma'am.
too. Which medication, like a vaccine too. Vaccine is updated, not those are supposed to be WHO supposed to know all these if every country
So
sent
means
them.
means WHO can tell me if India today
Yes,
the mutant is X and the medicine is Y.
yes, yes. If India has provided, yes.
Okay, that's not binding. I see.
Again,
I understand.
WHO is not a binding. It is just people get together so we know about things. That's all the purpose of WHO. Yeah.
And this is my common experience. How long does a particular, like you were saying, that next time the next problem will be maybe the bird flu. Huh.
Yes, there
So
is a CDC
how is
just
it estimated? How is it estimated that
so
next
the
will be this?
CDC, yeah, so the CDC, like couple of outbreaks you have, CDC reports. CDC is the Center of Disease Control in
Mm-hmm.
US, and many country actually follow that. So if you go to CDC website, they will tell you which area there is epidemic on bird flu. Now remember, every viral infection can be initially epidemic, and depending upon the travel and contagiousness, it can become pandemic. And based on influenza, we know that is very influenza is actually worse than COVID, because they don't
Yes.
just mutate, they do what we call antigenic shift. Their whole antigen shifts, which is worse, because COVID is actually just the antigen is the same as spike protein, right? So it's not
Yes.
antigenic shift. But flu is even worse than COVID because they mutate and they have antigenic shift. So like a
And this is
two whammy. Yeah. So yes, they definitely keep eye on that.
my last question. Uh, as you said, flu is more mutating than COVID,
COVID,
but
yes.
the
Faster,
flu,
faster
yeah.
mutation.
So flu. I mean, does it mean you are talking of the flu which needs a vaccination, or the common
Yes.
flu, that
No, no,
we
no.
take
Common
medicines.
cold is not flu. Influenza.
No, no,
Influenza
not common
is
flu, influenza. But influenza, when it breaks out, also we prescribe medicines and we go to medical shops, and we do not always go for vaccines, at least in India. That's my
yes.
experience. And so those
Mhm.
medicines are also updated or not?
Yes,
They are
it is.
so
There are
frequently
updates.
updated.
Yes,
The
yes.
formula written on the medicine scripts that do not suggest that anything is updated.
So,
These are
so
chemical
again,
names.
not
These are
everything is
chemical names.
absolutely new.
Now, madam, let me complete. These are chemical names written. I do not think that there is lots of cultures of something, something. These are chemical names, no?
Yes,
So how does it?
antiviral are chemical names. Correct.
So they are not cultures of any bacteria,
No, no.
any virus.
Yeah, no,
Uh,
no. Those,
uh,
yeah, those are
no.
not. Yeah.
So
It's
how
like
do I know the
antibiotics.
chemical? Achha, that's only answer.
Yeah,
Okay,
yeah.
ma'am.
So
Thank you so much.
antibiotics are bacteria against bacteria. Antivirals are against virus. So
The
Tamiflu, if you
antivirals.
know, yeah, antiviral like a Tamiflu is an antiviral which is given in influenza, similar to any bacteria. Those are not actual virus. Those are different
Okay,
chemicals.
okay. It is always a culture.
No.
Okay, ma'am.
So
Thank.
the way to do culture is what they do, how to find out which antibiotic or antiviral is going to kill that particular. So they create a culture of that particular organism and they put the medication into that culture. And the culture, everything is killed. That means that is, we know that works for that. Okay, there are more to it, but this is a layman
Yeah,
way to
okay, okay.
explain.
Yeah,
Yes.
okay, okay. Thank you. This is all are going above my head now, slowly. Up to now, I thought I understood something. Thank you so much, ma'am.
I know it is a very complex subject and I try to do in layman, but it's kind of difficult everything to explain. Okay, who's next?
Thank you. Dr. Jha, sir, I know you will have certain comments and certain discussion points. So over to you, sir. Dr. Jha.
No discussion or comment. uh, uh, simple question. I just wanted to keep myself updated. Is there any new development for leprosy? I'm talking of any anti-leprosy vaccine. Because we
So,
have had this National Leprosy Control Program very early after independence, and we still see a lot many cases of leprosy.
mhm.
Uh,
And it's the same. So leprosy bacteria is the same group as the tuberculosis. So it's a mycobacterium. Both are mycobacterium, right? The only difference in contagiousness in the sense that if you get leprosy, so there is difference between infection and disease. So you can have infection, but do not develop disease. But you can have a highly contagious like tuberculosis. Everyone who comes in exposed to any person with tuberculosis, they will get infected. In other words, entire Indian population is positively infected. In other words, if you do the test, everyone is infected, but not everyone develops disease. In case of leprosy, is opposite. You don't get infection, but once you get infection, certainly you will get disease. But both are mycobacterium, and this is like a very ancient time. But again, this is only in developing country. And if there is no political will, nothing is going to happen. And India is so poor in research that I cannot tell you. There's so research is so like nowadays now a little bit something coming from India, but research is basically nothing. No research. Everything in India is used in medical science, mostly from outside.
that's a
And so
tragedy.
after this COVID Covaxin, I was so pleased to know that this was created in India. And the DNA vaccine is also first country to produce DNA vaccine. So yeah, hopefully new generation will come and they will do more research. But political will and pharmaceutical funding, because all research needs some kind of funding. And for that funding, who's providing? Government is not providing because they have to do many more things. So pharmaceutical company provide funding, and that is the initial research.
just to add a comment from my side. Yes, there has been some positive developments as far as tuberculosis and leprosy is concerned.
Mm.
The incidence and prevalence of both these diseases have gone down over the years. That is
Yeah.
an achievement that we can be proud of. But we
Mhm.
still see around 1.8 million deaths from tuberculosis.
Yes.
And in my OPD, and I believe in OPDs of my colleagues, we still see cases of leprosy,
Mhm.
multibacillary, paucibacillary. These are
Mhm.
academic. We
Mhm.
see foot drops very often because of
Mhm.
leprosy. Then all sorts of deformities, the wasting of these hypothinner, thinner muscles, everything.
Mhm.
But the incidence and prevalence have gone down.
Down.
This
Yes.
is more because we are probably detecting and treating more number of cases and
Yes.
treating them properly. Uh,
Hmm.
uh,
And
unlike
people are more,
older
yeah.
days when quacks
Mm-hmm.
were treating, ill treating, or not giving proper drugs in proper doses. Many factors are. This can be another session. There can be another session on this. But my question was: is there any new uh, uh, breakthrough as far as a vaccine against leprosy is concerned?
So
In
I have
India,
not
I am
heard
aware
about.
of what is happening.
Yeah.
We were trying to culture in armadillos,
Hmm.
still not successful.
Hmm. And that is probably biggest part of the hurdle. But I have not heard about leprosy vaccine. But there are a lot of work going on I mean tuberculosis vaccine and malaria vaccine.
Yeah. Malaria, I think now should be available in India very soon.
Hmm.
Vaccine against malaria.
Hmm.
That is one positive development here.
Yeah, and tuberculosis and HIV also is very
Yeah, yeah,
like a
yeah.
going research going on a lot. So hopefully.
This is an ongoing process. We have been able to do wonderful uh, job in cases of poliomyelitis, smallpox,
Hmm.
but then tuberculosis still remains a big problem. 18 lakhs people dying of tuberculosis. Yes,
Yeah,
we have a large population, 140 crores, but still 18 lakhs is a big number.
big number. Yeah,
Yeah, and
billions,
from a
billions of
disease which
people.
is very much treatable, now we have shorter regimes. When I started practicing, it was 2 years of anti-tuberculosis drugs, then came down to 12 months, then 9 months. Now we have a standard as per revised National Tuberculosis Program, a 6 months regime. Very
Hmm.
soon we'll have a 2 months regime. Even then, there are sizable number of dropouts.
That is a
Dropouts.
big problem. Yeah,
That is a big problem. Yes.
dropouts are the.
And the government, there are certain criticisms against our DOTS program,
Mhm.
directly observed treatment short
Mhm.
course for tuberculosis. Uh, if Ashutosh ji allows just 2 minutes, because I have some personal interest in this. Jharkhand was created in 2000. It came into being on 15th of November 2000. And I am not in government service, but the first health minister of Jharkhand was a friend of mine, and I was an office bearer of Indian Medical Association. I was sent as a representative of newly formed state of Jharkhand to present my or our state's concern about tuberculosis. And the meeting was about launching of DOTS, directly observed treatment short course for tuberculosis. The basic idea was that the patient goes to a designated center, he's diagnosed on basis of positive sputum culture, sputum showing Mycobacterium tuberculosis, not on X-rays or raised DSR or loss of weight and other parameters. What I wanted to share was that there was a meeting, all the top officials were there, and a meeting was taking place at India Habitat Center, which is a very costly place. All the way of it. And what was told to me that this program will be launched in Ranchi only, in the whole state of Jharkhand. Now, I had a big fight with those who were actually there to allot districts to states. I said, do you know about Jharkhand? How far is Dumka from Ranchi? And and this was an alternative. Patient takes one dose today, gap next tomorrow, and another dose day after tomorrow. How does a patient travel from Dumka to Ranchi, get his dose, then goes back, then comes back day after? So we had, and it so happened that it was at that time launched in all the 21 districts. Still, there were flaws. Patients traveling from far off areas, hilly terrain, going to a designated center. Nowadays, this has been revised that village level workers, once the patient is diagnosed, one full course of medicine. That box is marked for that particular patient, and supposedly a village level worker takes the medicine daily dose to the house of the patient.
Whoa,
This
that
has
is this is
helped
very
us, but there are so many dropouts and pitfalls that we are getting this is what I wanted to share with our learned audience, that we are seeing more and more cases of multi-drug resistant
yeah,
tuberculosis.
yeah, because
That
of the
is going
dropouts.
to pose a big problem because the
Mhm.
medicines are costly. The regime again goes for 2 years at least. So if the primary treatment is not affordable, patients are not sincere, the MDR cases will
Yeah,
probably be a big
uh,
concern for the health authorities.
it's the same thing. MDR, like a bacteria antibiotic
Yeah,
resistance also. Yeah, this is the problem. I think this is going to be one of the biggest problem, resistance.
challenges before the medical
Mm,
fraternity.
mm, mm. Yeah, thank
आशुतोष
you.
जी
Thank you
अवधेश
for
क्या है?
that.
अवधेश ने हाथ उठाया हुआ है बहुत
जी हाँ जी
देर।
हाँ,
अब
अवधेश जी भी
दो
है,
दोस्त
अरुण सर
आपस
भी
में
है,
बात करने लगेंगे तो बहुत सारी बातें हो
बहुत सारी बातें हैं।
जाएंगी।
और अवधेश जी भी है, अरुण सर भी है। अवधेश जी ने तो इनफैक्ट बहुत सारे क्वेश्चंस चैट में पोस्ट किए हुए हैं। एंड अवधेश जी, मैं रिक्वेस्ट करूंगा आपसे कि ये दो
मैं
तीन ये
सिर्फ
जो
एक
आपको
क्वेश्चन
बहुत,
पूछूंगा,
और बाकी
ओनली
सब
वन,
बाकी सबको एक
बाद में
रिक्वेस्ट करूंगा
बाद
कि
में।
उनको आप ग्रुप चैट में डालिए सर, व्हाट्सएप चैट में
ठीक है,
डालिए, so that we get answers, we all get
Yeah, I will answer. I promise. It may take some time, but I will answer if you put in the WhatsApp. I promise.
Yeah, and that's exactly what I'll do. My only simple question is कि जो इतने सारे information, misinformation, and I'm absolutely unintelligent layman. So I just want to know, कि given the current circumstances and with all these news, flashing all over, and what should be, as a layperson, my action in terms of response to COVID thing. I just want to be focused on the COVID thing. I've taken vaccines, my family, daughters, wife, भाई बहन सब लिए, तो अभी क्या करना चाहिए? सिंपल कि ठीक है, these are 1 2 3 things that you should do as a layman, क्योंकि I can't understand many of these things, तो I love to, लेकिन उतना अकल नहीं है, so I'll just limit it to that, कि what should be the course of action from a layman's perspective that you advise after researching all the things you have done and after all these news have flashed around.
Okay. So I will also stick to just COVID. So as I said earlier, that herd immunity prevents circulation of virus in community, right? And this is very difficult in terms of COVID. So in other words, unless until government tells you that these are the variant circulating and this is an updated vaccine, I don't know a layman person where they are going to go. But that's what government should do. Look into the variants in community and against vaccine, then you can get it. In terms of, so that's the herd immunity part, means everyone is immune to prevent the circulation of the virus. The second part is the prevention part, which is your job. Government job is also, but we cannot have lockdown. So what you should do, if you have any health issue, Please wear mask if you go in public when this is prevalent, wherever, when you are going in close proximity to your people, like a train or any places where there is so much crowd. And also do not touch your face and mouth that much. And this is for COVID, because COVID is a respiratory virus. In other words, it goes through your mouth and nose. Do not touch, keep touching, and keep washing your hand. Hand washing is still the best strategy to prevent infection. Okay, so this is these two things here. In anybody who is at home or wherever you are going and they are coughing and sneezing and touching, ask them to wear mask. You can tell them, please wear mask. That is this is my personal experience, that I always get cold and in winter season, always couple of times I will get. During COVID, I did not get cold this thing in entire 3 years because of the mask and hand washing. And hand washing I still do, but I don't wear mask. But since I stopped wearing mask, I have couple of times cold. So mask, even if it is not 100%, it still protects. People think that it's not, but doctors are wearing masks for a long time. We always wear masks when we are doing any procedure. Surgeons are wear masks when they are performing surgery. So it's not that it does not protect. It's not 100%, but it's not zero either. So whatever we can do to protect ourselves. Thank you.
Yes, this is my experience here in a small place. During COVID, except for those who actually suffered from COVID infection, the incidence of respiratory diseases, including upper respiratory tract infection, acute exacerbation of chronic bronchitis, the incidence actually went down. This is my experience. And this must have been only because of the use of mask and hand washing. And people were particular about sanitizing everything, surface. That is a fact.
And we see influenza cases in winter, many influenza cases and pneumonia. During COVID, we did not see pneumonia that much, unless until after COVID. And I did not see a single influenza case during COVID.
That is my experience.
Okay.
And we are so far from each other with the same kind of experience. Yeah.
Thank you, sir. Thank you. Ma'am, now I can see Arun sir is there. He had raised his hand. Sir, you can unmute yourself. All yours.
Am I audible?
Yes, sir. Very well.
Yeah. I have a general question. I have been hearing about immunity system of a person. My question is, when we say a person has a strong immune system, is it a holistic thing that he may be immune to most of the diseases, or is immune system something vertical wise? Somebody may be immune to smallpox, but not to say cholera or not to say COVID. So I repeat, my question is: the immune system of a person is a holistic thing, or it has verticals? Over to you, ma'am.
Okay. So yes, if you have strong immunity, means you can produce. So the immunity has multiple things. It's not just the antibody production, but I will stick to the antibody production. So if your immune system is strong, that means if you are exposed to any virus or any bacteria, the body will produce an antibody against. But you have to be exposed to that virus or bacteria to get the antibody. In other words, you need to get infected. So it's not that if you are infected with measles, you have antibody, and you never been infected to chickenpox, you will have antibody for chickenpox. No, you have to get exposed or vaccinated for that particular disease. In other words, antibody is very disease specific. So you get antibody only for that particular disease. The human body produces antibody for that particular pathogen you are exposed to, either in form of vaccine or in form of natural disease. And it is, yes, holistic. It is entire good immune system means you will produce for everything. And poor immune system or suboptimal immune system means you may not produce for many different things, not just the COVID.
Thank you. Good enough. Ashutosh.
Thank you, sir. Any other questions? Any other points from anyone? Okay, so while
Thank you.
we are planning to close the sessions, ma'am, Dr. Sarita and Dr. Jha, and I think both of you may consider this what I'm going to talk. So this is related to what Sarda Prasad ji already said. And that is about people suffering from autoimmune diseases on those who are on immune suppressant medicines. When in India, when the COVID vaccine was released, Dr. Jha will recollect this, and many of us would recollect that it was for various groups initially because vaccines were produced in limited quantity. So initially it was for up to 60 years of age, and then it was up to 50 years of age, 40 years of age, like that. Now, in the first category, when it was released for people up to 60 years of age, it was simultaneously released for all the people who suffer from autoimmune disease or those who have the immune suppressant medication. I mean, irrespective of their age, they were eligible to take those they were eligible to take the vaccine. So now coming to the point which Sada Prasadji was raising, because people they already have low immunity. Uh, was this thought behind giving them preference for vaccination, that the vaccination will help them prevent COVID, or what was the reason? I mean, how does that mechanism work for people who are on immune suppressants?
So if you remember, I said immune suppression means you are suppressing their immunity. That means one of these antibody formation, right?
Right.
So in other words, they are suppressed. They will not produce antibody. So, and also they are, because of that, they are high risk for disease if they get infected by COVID. So they will have much more severe disease if they are infected. So how to protect that? And that's why vaccine were given to those before anyone else, because to prevent whatever antibody they can produce against that bacteria or virus, they should get through vaccine rather than from disease. That is the purpose of giving to those people. Now, one way is to monitor how much antibody they are producing is to check the titer of the antibody after vaccine. And we do that for many patients. Does that answer your question?
Yes, ma'am. I think that is in place.
So I can explain again. So what is immune suppression means? That's number one you have to understand. So for number one, autoimmune disease or cancer, anything which can suppress your immune system, when they are on immunosuppressive, means they are not going to produce enough antibody if the disease hits them. If the bacteria or virus hits them, they will not be able to produce enough antibody to kill that virus or bacteria. And the disease will be very severe in that case. If we give vaccine, they will have enough, presumably enough antibody that if they get infected, even if they get disease, it will not be that severe. Okay, so that's the
Yes,
purpose of giving.
yes, got it. Thank you.
Mm.
And one more point, ma'am. Sorry, I'm going a little extra.
No,
Taking
go ahead. Yeah.
One of the points mentioned in your slide was that 13 billion vaccines, COVID vaccines have been administered world over.
Doses, yeah.
13 billion, 13
Mhm.
billion you have mentioned.
Mm-hmm.
The world population is 8 billion. And of
I
course, the
said
full.
doses. I said doses.
Yeah, exactly. I'm coming to that. I understand that point.
Yeah.
You said 13 billion doses of COVID vaccines were administered. The world population is 8 billion.
Mm-hmm.
And in India, by and large, 3 doses of vaccination was supposed to be done. For Dr. Jha, sir, you can correct me if I'm wrong. Three doses of vaccination for every person was supposed to be done for uh, having understood or having certified as fully vaccinated, isn't it? Three doses, sir. So now,
Yeah, yeah.
so going by that mathematics, just about half of the world population would have been fully vaccinated, though we do not have the statistics. Maybe some people took only one dose of vaccination, some people took 2 doses, some people took all the 3 doses. So finally we can say that a little over 4 billion people would have been vaccinated uh, out of the entire world population. So just about 50% or 50%, a little more. So was the kind of respite from COVID primarily because of the mutation of the virus which made it weak, or was it also coupled with the vaccination which kind of give immunity to the major part of population?
So yeah, so the herd immunity is, that's why it's a big topic, how to get the herd immunity, and it is disease or pathogen specific, depending upon how much you get the herd immunity. So that vaccine 13 doses, yes, that's a part of. Also, people got so many, almost everyone in this world got infected. Okay, so the natural immunity is a part of. We don't want that because so many people die. So the best way is to get immune to that disease is to get natural infection. But do you really want to get naturally infected and die from it? Because you may not die, but your neighbor can die by getting infection from you. So the herd means entire community. So when you make a public decision for any particular process, you make for entire population. It's not the disease, one person specific. So I don't want to take vaccine. Okay, fine, you don't, but you don't infect others. You can be infected and you can infect others, and in which your grandma may be infected, immunosuppressed, and die from it. So that's the short answer, vague answer, but that's what disease versus vaccine. But it's not different. In other words, you are getting vaccine from same virus or bacteria. Vaccine is part of the virus. I am giving you live attenuated vaccine. It is the same virus which gave you disease. I made weak in the lab and giving you back. So that's, or I take the part of the virus and give you that as a vaccine. So it's not much different. The only reason why we don't want to be naturally infected because disease is produces. So now the next point is one of the actually infectious disease, very jokingly doctor says that virus know each other, virus and human know each other now, why to kill each other? So it's like a nice symbiosis happened, and definitely the new one KP2, which is now circulating in US like a 30%, it is much more transmissible, but it's not severe disease producing. So that's what COVID is doing. It's just getting no humans and getting milder so they can live easily among us. That's a
And
natural
about
selection.
sorry. About what Asutosh said about the data. I mean, so many doses of vaccine and so much of population. In Indian context, we are a little confused. In Ranchi, I was one of my disciples was in charge of vaccination, and I was one of the public figures trying to vaccinate as many people as possible. And we had a center at our office in Ranchi, the Indian Medical Association office. And the program was doing very well. But when Asutosh raised this question, now I know and I remember that some people took only one dose, some two, in spite of my best efforts to contact. We had their phone numbers, we have their Aadhaar, these two were mandatory. Repeated calls, some never came for second dose, and the third dose, which was booster, not mandatory for everybody, very few, even amongst doctors, took the third dose. So that mathematical equation doesn't work. We still don't know what is the actual number, what of people, what percentage of population got vaccinated. At least in India, we don't have any data.
Yeah, so that data is from WHO site. And so that total of 40 vaccine, we have COVID vaccine, many countries have created their own vaccines. So total number of type of vaccine is 40 and total doses were given 13 billion. So that's the data from them. You can go explore.
Simple arithmetical equation, इतना dose, इतना population, वो नहीं बैठेगा. ये अरुण की को complicated mathematics है, advanced mathematics.
बिल्कुल बिल्कुल
क्योंकि
बिल्कुल
उसमें
उसमें
बहुत से verticals हो गए. कुछ ने एक लिया, किसी ने दो लिया, किसी ने
बहुत
तीन
सारे
लिया.
नहीं लिया,
And I
किसी ने
know
नहीं
a
लिया.
person, डॉक्टर fraternity में, जिन्होंने एक ज्यादा डोज लगवा लिया कि मेरी जान बचे, बात का देख. And on उसमें बेईमानी नहीं. उसमें what was happening was there was a vial and it contains certain number of doses of vaccine. If you open it, you have to use it. Now a vial was opened and only one patient was waiting. The 4 doses got wasted. तो डॉक्टरों ने आपस में ले लिया कि एक डोज एक्स्ट्रा दे लेते हैं. ये भी एक सच है. I know of that.
सर हम लोगों ने स्टैटिस्टिक्स की बात की, डाटा की बात की और पंकज मनी जी ने अपना हाथ उठाया है. तो
हाँ,
डेफिनेटली
पंकज का डोमेन है.
पंकज जी ओवर
बहुत
टू
अच्छा
यू.
सेशन था. थैंक यू मैम, बहुत अच्छा सेशन था. आपने
Thank
बहुत
you.
अच्छा से एक्सप्लेन किया. और आपने जो लिंक भेजा भी था एक ग्रुप में, तो नेक्स्ट सेशन में मैं इन चीजों पे कवर करूंगा कि आखिर कैसे
Yeah, herd
ये
calculation. Good. Yeah.
एक्चुअली जितने भी रिजल्ट्स आते हैं, फॉर एग्जांपल इवन इन मेडिकल साइंसेज, तो कहीं ना कहीं स्टैटिस्टिक्स बैकग्राउंड में
Okay.
स्टैटिस्टिक्स
Don't say kahin na kahin. It's everywhere.
Everywhere. Yeah.
You were talking
Definitely.
about जो आप लोग बात कर रहे थे, आप और अरुण रॉय बात कर रहे थे about blindness and randomness. Actually, that's how medical research is done. So the best research is random, whatever pseudo random or whatever you want to call it, but computer generated double blind means neither investigator
Random
nor
control.
the patient knows. Double blind placebo control means one person will get the actual thing, another will be, but they don't know what they are getting. And it's randomized means it's not that someone getting favor, it was computer generated. So double blind randomized placebo controlled, that is the best way to do research in medical science.
So, what I was saying in my session, I will try to cover those things. And basically, especially in medical sciences, there are so many ethical issues as well. We cannot always try to do randomized things. So it has been a major challenge. Because cannot put anybody's life to risk just for testing or experimenting.
Yeah, exactly. Yeah. Randomization is not always important. I mean, not only always possible.
Though it is randomized control method is considered as a gold standard, but practically in medical cases, it's not always ethical and ethically possible.
Yeah.
So
newer research. I will just add this. For newer research, it is possible. But let's see. We know the vaccine work. You cannot randomize 2 groups. One group gets the vaccine, another group does not get the vaccine. Like if you are doing, so it's in a randomization, especially something of a proven benefit, you cannot randomize that easily. So there are a lot.
So definitely everything has pros and cons. So always it's not feasible. There are observational studies as well, in contrast to randomized approaches. So a lot of things are there. The point I was trying to make that a lot of controversies are there regarding statistics and data and how reliable they are even in medical sciences. So and to be very frank, nobody has clue at deeper level to this at this point in time. When you go deeper, because for the centuries there has been a debate whether smoking causes cancer or not, lung cancer or not. Statisticians over the centuries have fought over this question whether lung cancer is caused by smoking, whether some data suggests no, some data suggests yes. So this has been a major conflict for statisticians over the centuries. Okay, so and still they are not sure that what happens. So I'll be talking about all these things in my session, that how deep the things are. And so again, thank you for the wonderful session you have taken today. So it is just a starting.
Thank you, Pankaj ji. Good precursor to your talk next week. And so,
Yeah.
yeah. Indu ma'am wants to say something. Indu ma'am, you can, yeah, you
Yeah,
are unmuted already. Yeah.
yeah. Thank you so much, Sarita ma'am. I mean, it was really an eye opener for me. Many myths have been busted, and so much of clarity about vaccines, what they are and what they are not, are
Mhm.
there. You have really clarified them.
Thank you.
I missed actually the first half an hour of your talk. I wonder if you touched upon that particular point which is making round these days in the news, that the vaccine that we got is causing a lot of people the heart attacks. Like, all the young people who are getting the heart attacks is because of the COVID vaccine. I wonder whether you covered that or whether you touched upon that. But do you think this part of the story is true?
Okay, so we covered the heart attack part, myocarditis, pericarditis for the mRNA vaccine, which is the
Okay,
Pfizer and Pfizer and Moderna in the US.
okay, okay.
In terms of heart attack, like a heart attack means coronary artery disease and MI part kind of heart attack. I have not heard anything about for the vaccines which are given in US. The heart attack is related to whether thrombosis part of AstraZeneca. It is possible that that is Johnson and Johnson and AstraZeneca. Two of them are they have reported TTS or thrombocytopenia and thrombotic disorders, where you can get thrombosis or clotting in brain. It can be any place. So something we call confounding variables, because thrombocytopenia and this disorder, I mean TTS short form, is seen with AstraZeneca, and initially it was reported in young women. Now, many young women do take oral contraceptives, which is a risk for thrombosis. So whether that was together or not, and also this COVID itself can give you more thrombosis. So whether these are the confounding variables, when they do research, they exclude, they have a mathematical way to do exclude the confounding variables, and this is going to go long time. This research is not going to be over. And there are a lot of mathematical or mathematician are also involved to find out how to correlate these incidents with the vaccine itself. So I don't have answer that if MI is the vaccine which in India given, whether MI is part of this or not. But one thing I can tell you, people are using all kinds of hormone to make bigger muscle, a young generation, and that is actually gives you thrombosis, similar to what women get from oral contraceptive. If men get use the testosterone, the male hormone, to make bigger muscles, you can get heart attack too from that too. And there are many drugs which can give you a heart attack when you are doing exercise, intense exercise, and taking their drugs. So again, those reports you see, I mean, there is no way to know what exactly happened. So I don't think we should be worried about, as long as you are not doing all those things. Vaccine
Mhm.
side effects are very rare, even after COVID vaccine. In general, side effects from vaccines are rare. It's in one few in millions. So the
Mhm.
effect of benefit is much more than the risk. So I think you don't need to worry about having heart attack from vaccine.
Yes, ma'am. Yes, ma'am. Thank you so much, ma'am. And I can see that correlation because most of the well-known figures who died of heart attack, and the reason was given that they, because of the COVID vaccine, they died. They got the heart attack. Most of them were, they were using the gyms, and obviously in the gyms they are taking all those extra
Yeah,
proteins and all that.
yeah,
Okay.
supplements, all kinds of
Yeah.
stuff.
I can see the connection. I can see the connection. Thanks a ton, Sarita ma'am. It was such a useful talk, and thanks a ton about it.
Thank
Thanks
you.
a ton.
Thank you, ma'am.
And
I
just
sorry. I was just saying that I know that there will be many more questions, but may I request that we continue this discussion on the WhatsApp group because it is close to 2 hours and the
Yeah.
speaker also has been.
Yeah.
The speaker has no
Yeah.
problem, but the speaker's husband is waiting, so I need to go now.
So, ma'am, thank you so much. And it was one of the most popular sessions. Thank you so
Yeah.
much. You actually, you very rightly titled it information and misinformation. You cleared a lot of misinformation. Thank you, ma'am. Thank you and have a good day. I'll
You
stop
too.
Thank you.
recording.
Thank
thank
you,
you.
ma'am.
Thank you, everyone.
Thank you, ma'am. Thank
Thanks.
you.
I like the focus of your session and the crispness as well. Thank you
Thanks.
very much. Pranam.
And I'll be talking about confounding in my session.
Okay, yeah, great. Thanks.
Thank you. Have a good day. Bye.
Thank you.